Have you heard about changes in coverage at the Buffalo Medical Group? It was announced this week that dozens of primary care physicians there will become out of network under Highmark, Blue Cross Blue Shield of Western New York Medicare Advantage plan. We're told that will happen beginning July 1st of next year. So today, I spoke with patients and a Medicare sales manager about the change.
Actually, it was my wife, Janice. Janice contacted Mike Wooten because she's been hearing information about the negotiations between Highmark and Buffalo Medical Group. Because of that, she felt that the patient's voice was not being heard.
Janice Horowitz does not want to have to find a new primary care physician, but she may have to after learning her doctor with the Buffalo Medical Group will become out of network under Highmark Blue Cross Blue Shield of Western New York Medicare Advantage plan.
Buffalo Medical Group is a great group, and I really love having my doctor there. I also like having Highmark insurance. I've not had any issues.
Janice is trying to figure out a way to stay with her doctor of 15 years.
And I think we all understand and realize the doctor-patient relationship, and having to switch doctors would obviously create a little problem.
This week, it was announced that Highmark and Buffalo Medical Group were not able to reach an agreement in their negotiations.
Alyssa McGovern, AAA Medicare sales manager, tells me the majority of doctors impacted are primary care physicians.
This is common each year where certain medical groups and certain carriers will have negotiations because just like everything else, prices are changing.
McGovern says about 40 of the roughly 3,500 doctors currently in network at Buffalo Medical Group will be impacted.
So it's a small percentage, but we know that your doctor matters. So the first step is to check and see if they're still covered. It's effective July 1st, so we have some time, and we can always shop you if your doctor is falling out of network July 1st.
Patients impacted say it's not that easy to find a new doctor.
One of the issues that is often lost is the anxiety and the stress that it put on people that are in Medicare age.
So after all these years, you could potentially have to switch doctors. You're still trying to figure that out?
I am. I can either switch my medical plan, I can switch my doctor.
And to start over again at this point?
It's not a pleasant thought.
For example, we know that.
So if you have Medicare and you are concerned about coverage, you can contact the AAA insurance agency. We have more information at WKBW.com.